What's the device really doing? This device is a 2-electrode system, and the device sums together the 2 high frequencies and delivers them to the first electrode. When they pass through the first electrode, we get this 3-inch diameter hemisphere where this active electrical field takes place. This is an alternating current system. So what that means is the device alternates the delivery of the 2 summed high frequencies to the 2 electrodes. So instantaneously, after it delivers it to the first electrode, the device delivers the 2 summed high frequencies to the second electrode. And the electrical field forms in this 3-inch diameter hemisphere beneath the second electrode. And so the device continues to alternate the delivery back and forth so quickly between the 2 electrodes, the body never realizes the signals have left either location. So the net effect, it's as if you're treating 2 distinct volumes of tissue simultaneously. Since the active electrical field forms in this hemisphere beneath the first electrode and in this hemisphere beneath the second electrode, the electrodes must be placed directly over locations of pain. We never surround the pain site like you do with interferential TENS or other forms of stimulation. The way we focus signals to different parts of the body is by changing the ratio of the area of the electrodes relative to one another. If you have 2 electrodes and they're the same area, the density of the electrical field is the same under each electrode. The area is the same. So we can treat 2 distinct locations of pain. So if you have a patient with bilateral lumbar pain, we can place 1 electrode 3 inches to the left of the spine, a second electrode 3 inches to the right of the spine. They'd be directly over pain locations, and the patient feels nothing on the skin in between the electrodes. They only feel the sensation of the active electrical field in the hemispheres beneath each electrode. But and one other thing, these electrodes are independent of one another. There's no maximum distance as they move further apart. The strength of the electrical field doesn't change. They're completely independent of one another, which is different than conventional stimulation. But let's say you have a single location of pain. Then we pair a smaller area electrode with a larger dispersive pad. The electrical field, the density of the electrical field is much greater under the smaller electrode. So that small electrode is going to go directly over the single location of pain. The bigger electrode is still active, but it's a larger area, so the electrical field is spread out over that larger area. The density is less. The strength of the sensation is much less, and so the patient's not going to feel as much under that electrode. But in addition, we want to place this larger electrode over a location that's comfortable to receive stimulation, because we only want the patient limited in how high they go up in intensity by what they can tolerate under the smaller electrode. We don't want the bigger electrode to act like a distraction. So the comfortable location to always place the bigger electrode is going to be over a bony prominence. So let's do an example. Let's say you have a patient with some type of shoulder pain. Let's say it's biceps tendonitis. So the patient's going to point to the center of where it hurts. That's where the small electrode is going to be placed. The larger electrode, the comfortable bony prominence location, is going to be along the spine of scapula. So we're going to take the front corner of this electrode, we're going to be right behind the posterior to the AC joint, and we're going to run this at an angle right along the spine of scapula. It's a super comfortable place to receive stimulation. The patient's only limited in how high they go up by what they can tolerate under the small electrode, which is right over the single location of pain. So to make it easy, we created this quick reference guide. And this becomes the cheat sheet that you can use during the initial time period that you're using the device, and it helps you come up the learning curve. So in this quick reference guide, we show all the different locations around the body as to how and where you place the electrodes. And this is an important tool. Before we get into going over all the locations of the body, let's go over the nomenclature of the electrodes. There's 3 different size set electrodes. This first set that I showed you, where we where we have two same size electrodes, we call that the B set. B stands for back or bilateral pain, but it's really for two locations of pain. And we can use this on any location of the body. Typically, if you're on the lumbar area of the back, we're only using this size set, the B set. Okay? For single locations of pain on the extremities, we use this set that I demonstrated before. This is called the E set. E is for extremity pain, single locations of pain in the extremities. So you would use this set for a single location of pain on the neck, the shoulder, elbow, wrist, hand, finger, knee, foot, or ankle, but not in the mid-torso part of the body where we're dealing with larger muscle groups and deeper nerves. For the mid-torso part of the body, we have, for single locations of pain, we have the U set. U stands for unilateral, or single location of pain. And this is a 2-inch diameter pain site electrode paired with a much larger 5 by 8-inch dispersive pad. This would be for treating single locations of pain on the quadriceps, the hamstring, the hip, oblique, a rib contusion, but we do not use this to treat unilateral low back pain. If we're on the back, we're using the B set, even if it's a single location of pain. So that's how we split up the different size sets of electrodes for treating different locations on the body.